Start off by cleaning my hands here for 20 seconds. Hello, my name is Dylan. I'll be the nurse that's going to be taking care of you today. How you doing? Good, good. That's good to hear. Can I get started off with your first, your last name, and your date of birth, please? Kim Possible, 4/20/1989. Okay, perfect. I'm going to go just check your wristband there. Looks like that does match. Okay, and then are there any allergies I should be aware about before I begin? No allergies. Do you have any pain or discomfort at the moment? No? Okay. So today your doctor just ordered for the insertion of a urinary catheter, as well as for me to collect a urine sample from you. Is that okay? Yes. Have you had this procedure done to you before? Yes. Okay. But just to re-explain, what I'm going to go ahead and do is I'm going to go ahead and clean the perineal area. Once it's fully clean, I'll insert the Foley catheter in, and from there I'll collect the urine sample into a syringe and transfer that urine from the syringe into a specimen cup, which I'll send off to a lab. Okay. Do you have any questions or concerns about that? No? Okay. Clean my hands here for 20 seconds. I'm also going to note that the patient's condition is stable and that there are no signs of distress at this current moment. Okay, I'm going to go ahead and just grab my sanding wipe here, clean the table for 30 seconds. Okay, I'm also going to clean the sides of my table as well to make sure I have a nice and clean workspace to work with here. Okay, perfect. Take off these clean gloves, clean my hands here for 20 seconds. We'll wait for my table to dry for a minimum of 2 minutes. While that's drying, I'm going to close the curtain to maintain patient privacy. I'll put you in a supine position here. Clean my hands again for 20 seconds. Looks like my table has now been dried for about 2 minutes now, so I'm going to go and place my supplies on top of the table there. Okay, so I have a couple supplies here. I have my stat lock stabilizer, my CHG prep pad, I have an empty 10cc syringe, and lastly I have my Foley catheter kit here. Just drop the plastic there. Perfect. Alright, so Kim, I'm going to go ahead and clean your perineal area now, okay? Is it okay if I just bring down your blanket and lift up your gown? Yes? Okay. Would you also like a nice warm blanket to keep you cozy as well? Yes? Okay. So I see that your chucks there are clean, intact, and dry. Okay. Here's that warm blanket for you. Okay, and then if you could just externally rotate your legs for me, I'll help assist you in that as well. Perfect, thank you, Kim. And then I have my basin full of soap and water, and I have my 2 towels here, one to clean with and one to dry with. Okay, just open up the labia, swipe down, this side here, just one more on this side here. Okay, you go ahead and just pat dry now, okay? Pat, 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 pat. Doing okay there, Kim? Yes? Okay, I'm gonna go ahead and dispose of this basin now. Go ahead and just toss these gloves out. Clean my hands here for 20 seconds. Get a pair of clean gloves here. Alright, now I'm gonna go ahead and open up my Foley catheter kit. Making sure I'm only holding the 1-inch border. Go ahead and open up this kit here. Okay, I'm going to go ahead and adjust the sterile field by only touching the corners, the 1-inch border. Okay, I'm going to go ahead and grab my sterile gloves that I'll be using. Okay, drop those there. I'm going to go ahead and grab my empty 10cc syringe here. Perfectly dropped. Let me go ahead and drop my stat lock here. Okay. And lastly, I have my alcohol prep pad, or my CHG prep pad. Pardon me. Still doing okay there, Kim? Perfect. Take these gloves off now. Clean hands for 20 seconds. Go ahead and open up my pack of sterile gloves here. I'm going to make sure I'm only holding it from the 1-inch border. Again, doing this to prevent any sort of contamination from occurring. Okay, let me go ahead and grab my ear cuff here. Okay, go ahead and just grab this inner cuff here. Okay, I'm going to go ahead and adjust this cuff here. Making sure none of my inner cuffs are exposed. Just going to go ahead and just roll that down there. Okay, it looks like none of my inner cuffs are exposed there. So I'm going to go ahead and just move back to my kit. I'm going to go ahead and grab this sterile drape here, only holding it from the 1-inch border. Okay, let me go ahead and place this on top of you now, Kim. Perfect. I'm going to go ahead and just grab this drape as we won't need this. Go ahead and just grab my here. My supplies, I'm going to drop them into my kit. So I have my lubricant, I have my CHG swabs there, and I have my saline. Toss that out. Go ahead and grab my specimen cup. Place this there. Open up my swab sticks here. Open up. Okay. I'm now going to go ahead and just open up my plunger here. Drop that. Making sure everything stays within my sterile field here. Okay. Go ahead and just lift this up, hold this from the bottom here, pull this to there, grab halfway through. Okay, reaching around, I'm going to go ahead and grab my lubricant, place my catheter into the lubricant tube. Okay, perfect. And lastly, I have my saline here. Just going to go ahead and just drop this into the orange port, making sure it is as secure as possible. Okay, looks like all my contents are into the box there. Go ahead and just grab it, the outer edges here. Transfer this into my sterile drape here. Okay. All right, so Kim, I'm gonna go ahead and start cleaning your perineal area with the CHG swabs. I'm gonna go ahead and just open up the labia here. Okay. Go ahead and just swab this side there. Go ahead and just swab that side there. And last but not least, go ahead and just swab the middle right there. Perfect. I'm gonna go ahead and just toss this pack out, prevent any sort of contamination. I'm gonna go ahead and grab my catheter here. Okay, I want you to inhale and take a deep breath out on the count of 3, okay? Inhale, 1, 2, 3. Beautiful, thank you. Keep exhaling, okay? I see a flash of urine. I'm gonna insert 1 to 2 more inches. Perfect. Okay, I'm gonna go ahead and just let go of the labia ever so gently here. Okay, go ahead and just fill up my balloon. Still securing the catheter with my right hand here. Okay. Now that that's secure, I'm going to go ahead and just tug just a little bit to feel resistance. So I do feel resistance, so that means the balloon is secure in there. Okay. You go ahead and just toss out the supplies from the box I won't be needing. Toss this lubricant out. Okay. So now I'm just going to go ahead and pull this up here. grab my sterile tubing. Go ahead and just kink my tubing here. Okay. So now I'm gonna go ahead and just grab my CHG swab and scrub the hub for 5 seconds here. Okay. I'm gonna let that air dry for at least 5 seconds before inserting this. Okay, it's been 5 seconds. I'm gonna go ahead and just insert my syringe in. Perfect. I'm gonna go ahead and pull about 6 to 7 ml of urine. Do you feel any pain or discomfort though, Kim? No, did you feel any pain during the insertion? No? Okay. I'm gonna go ahead and just pull that out, place that into my sterile field. Go ahead and unkink this tubing here. Go ahead and just place your gown back over that. You go ahead and just drop the sterile gloves, clean hands here for 20 seconds. I'm now gonna go ahead and just get the clean gloves here now. Okay, Kim, you doing okay there? Yes, I'm just gonna transfer the urine into the specimen cup now. Okay, inside of the lid facing up here. I'm gonna go ahead and grab the urine here, making sure it's not too high up and not too low. Strap the urine into the specimen cup there. Okay, all done with that. I'm gonna go ahead and just place that on top here. I'm gonna put the patient's name, date and time, and MRN. Okay. Take off these gloves here, clean hands 20 seconds. Now I'm gonna go ahead and just grab another pair of clean gloves here. Alright, so Kim, I'm gonna go ahead and place the stat lock to the side of your leg now to attach the catheter and secure it there. Okay. Alright. So grabbing the stat lock here. Okay, I'm gonna grab my skin protectant here, put this on the outside of the leg. Okay, I'm gonna go ahead and just put this here, just a little pressure, okay, Kim? Okay, a little pressure here. I'm gonna put the bag here on the side of the bed, lower than the level of the bladder in order to allow for drainage of urine. Okay, I'm gonna go ahead and just toss these out. You doing okay there, Kim? Any pain or discomfort? No? Okay. Okay, I'm gonna go ahead and just lift your blanket up. Would you like to keep that warm blanket as well up there? Yes? Okay. Clean up my area here. I'm gonna put your bed to the lowest position here. Put your collar right here. Assess the environment for safety. Looks like there's no safety hazards. Okay, so now that we're done with the procedure here, I'm gonna go ahead and document the date and time of the procedure, the patient's tolerance, which the patient did not complain of any pain or discomfort. I'll also document that the size of the catheter used was French 16, and lastly, I will document that there was no sediment, no cloudiness, or foul odor to the urine, as well as other characteristics. Thank you, Kim.